We have a big problem in healthcare, and the problem is that we are incentivized to be sick. Does our insurance pay when we're going to the gym? Does our insurance pay when we go to try losing weight? But if you need a surgery, if you need medication for the rest of your life, if you need, something major, your insurance pays for it. So we are incentivized for sick care rather than health care, and so we want to change that. We want to change that narrative. We want people to be thinking about their health more from the standpoint of their happiness, because we're ultimately not in the health business, we're in the happiness business. Are healthier people typically happier or unhappier in their lives? Pretty easy, right? So what we want to do is essentially find ways to become happier in a system that doesn't incentivize that doesn't give us that opportunity. We want to find opportunities for that. So this is the definition that the World Health Organization has for healthcare, that health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity, right? So the World Health Organization is offering a different definition than what our health insurances are offering. Because if this was the definition that our health insurance offered, we would have a very different incentive program, right? And so what we want to do is follow this definition. I love this definition, right? This definition rocks. A complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. How do we move towards that? That's happiness, right? Happiness is moving towards that state. One of the things that we talk about is that your health should never limit your life. We believe that we can move towards a place where your health will not limit your life. And at the very least, in stages, right? So what is a better stage than you are in today? What is a better stage than someone in your family's in today? Some of your friends? Where can we go that is a step up? And what that means is, what is it that you aren't able to do, or you think about, maybe I should skip that you'd like to be able to do? And we think about it through the lens of 3 phases. So one of the challenges with health is that everyone wants it to happen like that, right? You want to start something and you want to be fixed. We've been trained that if you take a painkiller, your pain goes away. It doesn't really get to the root of your problem, right? But it does tend to fix your immediate concern. So if we're talking about true health, if we're talking about really getting to a place of happiness, then there are stages that we follow. The first one is relief or corrective, right? We want to feel better. So that's why we take painkillers or something that's going to help us feel better. But then we have to stabilize into a better place. We have to get to a place where the underlying issue is actually improving, and then we have to get it stronger. You have to actually start to get healthier, improve your longevity, start moving in that direction. And so that is really the way we see health. We don't see it as, I feel better today. We see it as, what am I heading towards? It's like your investment accounts, right? Your 401k, you're not touching until you're 65. But at 65, you're damn sure gonna need that, right? And so what are we doing now that's going to engender a happy, healthy life as we move towards the end of our careers, as we move towards, different stages with our kids, et cetera?